Hi, I'm Dr. Sridhar. One of the important questions we need to ask ourselves is how do we treat the nursing staff in our unit? One of the big differences between Western units and the units in the developing countries is the way we treat our nursing colleagues. So one of the movements when I was working in UK was to label all the clinical staff as clinicians to avoid the differentiation between nurses and doctors. So it's a very fair system because the nurses play an equally important or even more important role in patient care, especially when it comes to inpatient management. In the NICU, for example, the doctors do the orders and the plans and the procedures, while the nurses are the ones who stay by the bedside every minute and take care of the babies. So it's very important that we acknowledge the nurses as equal members of our team, listen to their contributions and support them, and also deal with them in an empathic way, as we discussed earlier. So this becomes very important when it comes to team building and also the respect for the team members, retention of the nurses because they feel they're empowered and they have more voice in the team. So it's very important that we support these measures and we encourage other team members to do the same. I discussed about empathy and feedback, and both these aspects apply here as well. Suppose we are rounding and we find that the nurse could have done something different. We normally are critical in the way we tell them. So we say, why is this not done? So instead of that, can we discuss that as to what exactly is the implication of the possible problem that has happened? Explain to them, for example, if the feeding tube was not left open on a baby on CPAP, we can tell them that, explain to them why, educate them. Education is the best form of improving care because that way we share our knowledge, we make sure that they understand why they are doing things, and the next time they will be more involved and they themselves will spread the knowledge with other colleagues whom they are mentoring or supervising. So my request, treat your nursing colleagues as equals as far as possible. Feedback in a gentle way and in a compassionate way, and use empathy in your day-to-day communication, not only with your families and the patients, but also with your colleagues. Thank you.